Hi guys, this is MEDICOS Hub. Today we are going to talk about a topic called as acute tonsillitis. Note that this is a concise and brief discussion in every topic for all medical students in undergraduate level. Read and revise what you are reading so that you can come out with flying colors in your exams. Okay, so let's start the topic acute tonsillitis. Before acute tonsillitis, I think you should know about what are the tonsils in our body. What are the types of tonsils? In case of in the oropharynx, what are the tonsils are present? Adenoid is present in the pharynx. It is single, okay, adenoid. Then dual tonsil, just above the eustachian tube, okay. Then comes your palatine tonsil. Okay, palatine tonsil present in the palate region, soft palate region. Okay, then comes your lingual tonsil in the tongue. All these tonsil forms a structure known as Walder's ring. Fine. I think you should know what is Walder's ring. This is Walder's ring. If infection or inflammation of tonsils occurs, means in these places infection and inflammation occurs so that it forms tonsillitis. So we should check this area, or we should know the anatomy of this region so that we can treat and manage the case. Fine. So we'll start acute tonsillitis. You should know the arterial supply, venous supply, nerve supply of these areas also. Okay. If you'll see the acute tonsillitis, it is basically occurs most commonly in children. Okay, school going children, basically school going children. And what is the causative agent? Most common causative agent is streptococcus. Okay, then what is the most classic feature you will see if a patient comes to you? In my ENT OPD, a patient comes, okay, I saw that he is inflamed or enlarged jugulo-digastric lymph node. This is the classic feature of acute tonsillitis. Okay, so remember this, most important in every exam, in Viva, in NEET PG, in your university exam, everywhere, enlarged jugulo-digastric lymph node, they will ask what is the classic feature in case of acute epiglottitis. Fine. Other features, other symptoms, classical features are there, but this is the most important feature that you should remember. Okay. And like fever, pain, obstruction, discharge, everything is present. But this is the most important feature. Then you will see what are the stages of the acute epiglottitis. I have already told you how the Wilder's ring consists of. This is the adenoids. I have told this is unilateral and single. Okay. Tubal tonsil. This is bilateral. Present above the eustachian tube. This is the eustachian tube. The tubal tonsil is present here. Fine. Then comes here palatine tonsil. This is your palatine tonsil. This is your soft palate. Below that palatine tonsil is present. And this is your lingual tonsil. It is present in your tongue, posterior part of the tongue. Lingual tonsil is present. All are bilateral except the adenoids. You should remember that adenoid is single. How should you differentiate between adenoids and tonsillitis? Adenoid is unilateral, tonsillitis is bilateral. Fine. Then we will see what are the stages of acute tonsillitis. Okay, actually these are 4 stages of tonsillitis. Basically these are 4 stages: acute catheteral, acute catheteral tonsillitis or superficial, acute follicular, acute membranous, acute parenchymal tonsillitis, and acute ulcerative. Okay, these are the 4 or 5 stages of the acute tonsillitis. You should remember. Fine. Then first of all we will see acute catheteral tonsillitis. What do you mean by acute catheteral or superficial? The tonsillitis, the infection is present superficially. Tonsil is a part of general infection of the oropharyngeal mucosa, mostly in viral infection. Okay. Acute tonsillitis. The first part is acute catheteral tonsillitis. This acute catheteral or superficial tonsillitis mostly associated with viral infection, and in this condition the tonsil is red and inflamed. See, red and inflamed tonsil seen, and is associated with viral infection. This is the thing you should remember. Then the second stage is acute follicular tonsillitis. Okay, I think you should know about the tonsil. These are tonsillar crypts. Okay, this is the tonsil, this is the tonsillar crypts. The infection goes towards the crypts, so the purulent material are present in the crypt region, so that they are looking like whitish appearance. See, the infection spread into the crypts with the purulent materials presenting at the opening of the crypts as a yellow spots. Fine. These are the purulent material present in the crypts. This is the stage of follicular tonsillitis. Then we will see the third stage. This is known as acute membranous tonsillitis. Okay, these I have told you. This is the tonsil, these are the crypts. First the infection spread in the crypts. After that the purulent discharge goes everywhere and totally spread over the body, so it forms a membrane like structure over the tonsil. So it follows, or acute membranous tonsillitis follows acute follicular tonsillitis. It follows the stage of an acute follicular tonsillitis where exudates coalescence to form a membranous membrane on the surface. Fine. I am again telling you that in case of follicular tonsillitis, the purulent discharges are present only in the crypts. After that, when more purulent discharge comes out, it will go and spread over the all over the tonsillitis, and it forms like a membrane. So this stage is known as membranous tonsillitis. Then we'll see the fourth stage of tonsillitis. This is known as acute parenchymatose tonsillitis. In this, the whole tonsil, see, the whole tonsil is uniformly congested and swollen, red, congested and swollen. In case of acute parenchymatous tonsillitis. Okay. Then we'll see how we'll diagnose a case of acute tonsillitis. First of all, we should know the complaints of the patient and the symptoms. I have already discussed about what are the symptoms, pain, fevers and all, and jugular-digastric lymph node enlargement on examination. Okay, then examination of throat, we should do examination of the throat. We should check the tonsil, we should press the tonsil. If pus comes out in case of recurrence, it is known as Irwin Moore sign and all. Inflammatory parameters, we should check for leukocytosis, because in case of bacterial infection or viral infection, leukocytosis occurs. ESR, CPR are elevated. Bacteriological testing rarely taken because it takes 2 to 3 days to obtain a definitive result. Rapid immunoassay also you can do for diagnosis. Then treatment, of course, as it is a bacterial infection, we should give penicillin group of drug known as amoxicillin. The dose is 40 mg per kg body weight. Okay, just remember this, penicillin, the drug of choice in this case, amoxicillin. Then we'll see what are the complications. These are two types of complications is there in case of acute tonsillitis. One is local or regional complication and another is systemic complication. Okay, in local complications, what are the complications? Are just I am reading these complications. These are not much. You don't just see what are the complications. Recurrent tonsillitis. Okay, acute tonsillitis may comes to chronic stage. This is known as recurrent tonsillitis. Peritonsillar abscess, parapharyngeal abscess, retropharyngeal abscess, otitis media may occur, sinusitis occurs, laryngitis also occurs, bronchitis also occurs. Okay, if tonsil goes to the peritonsillar space, it is known as peritonsil abscess. If the infection goes to the peritonsillar space, what do we call it? Peritonsillar abscess, otherwise it is known as quinsy. Okay, if it will goes to the parapharyngeal space, it will forms paratonsillar abscess. If it goes to retropharyngeal space, it forms retropharyngeal abscess. If the infection from the pharynx goes to the middle ear through the eustachian tube, it will forms acute and chronic otitis media. If it goes to the sinus, infection goes to the sinus, it forms sinusitis. If the infection goes to the larynx, laryngitis. If it goes to the bronchus, means inner part of the airway, it forms bronchitis. These are local or regional complications. Then we'll see what are the systemic complications. Acute glomerulonephritis. I think you should know. Streptococcal, post-streptococcal infections. What are these? In microbiology you have read already, I think. Acute glomerulonephritis, acute rheumatoid arthritis, and rheumatoid endocarditis. These are the systemic complications. Then I have already told about what is the treatment. As it is a streptococcal infection, you should give penicillin group of drug at least 10 to 14 days. You can give amoxicillin, you can give penicillin V, lactamase inhibitor also you can give, but mostly the drug of choice is amoxicillin. Amoxicillin, again I am telling 14 mg per kg body weight. Okay, then analgesic also you can give. Tell the patient to take bed rest, take much amount of water so that the patient become hydrated. Oral hygiene also maintained. This is all about treatment and all about the acute tonsillitis. If it will if it will occurs more times in your episodes, more than 5 or more than 7 once a year, this is known as chronic or recurrent. So that we think of surgery, it will goes to chronic. This will discuss in case of chronic tonsillitis. Okay, this is all about acute tonsillitis. Fine. At last, I'm again telling you that work hard in silence. Let the success make the noise. Okay. If you like this video, please give a like, do a share, and subscribe to our channel. Thank you guys. We will see in upcoming videos. Bye.